So various healthcare facilities were caught in the crossfire of last week's civil unrest that saw looting and destruction of property in parts of Gauteng and KZN. Meanwhile, patients face quite an uncertain future as scores of private doctors count the cost of the damage to their practices and salvage whatever's left behind. What can we make of this? Let's bring in Rachel Perumal, who's a caregiver to her sister, and her sister had dialysis appointments that have been impacted by this. Also joining this discussion is Secretary General of the Healthcare Professional Association, Dr. Prudence Buthelezi. To both our guests, thanks very much indeed for your time. It's lovely to have you on the program. Rachel, if I can begin with you, can you just perhaps take us through your ordeal and the ways through which the events of the week gone by have affected specifically the care that can be given to your sister?
Okay, so basically, with regards to my sister, she goes for dialysis out of town, about 20 kilometers out of our town. She goes on a Monday, Wednesday, and on a Friday. So what had happened is when the riot started on Monday, she wasn't able to leave the town to get to the dialysis center. By the time the Wednesday came around, she still wasn't able to go because there was actually a shortage of petrol or fuel. By Friday, we were basically panicking. We tried getting appointments in the town, but there was a nearby dialysis facility that actually was looted, and they were now trying to accommodate those patients at the dialysis facility, so they were not able to accommodate her. So what we had to actually do is enlist the help of some of the emergency workers and ask them if they could take her in their vehicles to the dialysis center for her dialyzing, and then bring her back into the town. But obviously with the rioting and with towns not allowing people to come in and out, it was a bit of a mission, but thankfully she was dialyzed on Friday.
Sure. It's the nightmare.
But she'd already missed 2 days of dialyzing. Part of what had happened was that she works in a mall, and she had kept some of her medication in the mall, and the mall was looted, so her injections as well were stolen. So it was a bit of a mission to actually get her the proper medication and treatment and care that she needed, which only sort of started materializing around Friday last week.
Sure. It's the kind of nightmare one hopes nobody would have to live through. How's your sister today? How's she doing?
She's doing much better. She's actually a lot better. She's been for her dialysis yesterday because on Saturday morning we queued at 3 a.m. at the filling stations to fuel up so that we all had petrol in our cars in order to sort of be able to be there for her if she needed fuel in her car, so to speak. So we basically fueled up a few cars to ensure that if something of this nature happens, we do have petrol again to be able to take her. And like a few of the facilities in Stenga did try to assist, but unfortunately capacity was maximum.
Right. And Dr. Buthelezi, what happened to Rachel and her family, I shudder at the thought that it happening to many other families across KZN and Gauteng. Have we come anywhere near quantifying the scale of the looting insofar as public health is concerned? I mean, we often speak about property and the economy, and those have their place, but the impact it's going to have on the health of many patients, are we anywhere near quantifying that?
Good morning. What we have realized now is that the private practices is the one that are being looted or being destroyed, because when we do our survey, we find that about 22 GPs practices are being affected, and 18 of the pharmacies are being banned, and about 80 of the optometrist practices that are being damaged, and 8 of the radiographers that are being affected. So we are still collecting data right now. And what I've already been getting information is that, especially those who are collecting their chronics in the GPs and in their pharmacies, they are facing crisis. So it's difficult for them to collect their medication on those facilities. at least the riot, they didn't destroy anything in the public sector. There's no public hospital that is being destroyed. But we know that the public hospital already has its own burden, but we are willing that can the government come into place and assist those private practices, private pharmacies that are being destroyed, so that their patients, they don't default medication and get to be given their chronic medication.
Sure.
So these are the talks that are still happening. As yesterday, we're having a meeting with the high officers.
Right. My understanding is that some of these practices have people who actually aren't insured. How is that complicating the kind of relief you can give to them?
Yeah, because as we check from other of our colleagues, some they do have the insurances, but some they do have the insurances, and they've mentioned that if the practice was destroyed through riots, they won't cover that. So we find that already they have problems with the landlords. They have problems with many things. Their staff, their saunas and everything else that has been banned, so they are unable to claim them. So as we are trying, many small businesses, many people are involved in trying to raise funds so that we can rebuild what has been destroyed. Like the radiographers, they've already sent me what will it cost to set up a radiographer practice, and it's close to 650,000, one practice only. So we really, really need more strong financial support to rebuild what has been destroyed.
Of course, Rachel, the impact here is not only for people who have to travel to a facility on a day-to-day basis to receive some care. I understand you also have a sister with leukemia who's in hospital. How did the events of the week gone by affect her?
So that is correct. She's actually in a facility that's about 80 k's away out of our town. So she's currently been in there for 3 weeks, and with 1 week being of rioting, they were not able to receive the blood and the platelets and the specific chemo medication that they needed. They were short-staffed. They were not able to get, so the staff did rally around and they managed to give them proper meals, but it was limited in what they could actually provide, because there was a short supply of, bread and basic needs throughout Durban and KZN. So they were put at a really big disadvantage with having to wait an entire week for some of their blood and chemo and stuff to come through to them.
How is this informing ways through which your family, I guess, is going to be providing care for both your sisters moving forward? I mean, I ask this question even presuming that there are any other options. There may very well be no other alternative.
See, right now, we're just trying to prepare, but we don't know what we're preparing for, and we're trying to ensure that we sort of source extra medication for my sister that's dialyzing. But for the sister that's in hospital for leukemia, there's actually not much preparation that we can do. That's nothing that we can administer. It has to be done in hospital. So there's not much preparation that we can do for her.
Tragic.
At this point in time.
Yeah. Dr. Buthelezi, how worried are you about some of these doctors, medical personnel, not wanting to return to the communities where they became victim of the kind of violence we saw in the week gone by? Because that too is certainly going to have far-reaching consequences.
It's painful. It's very, very painful, because most of the healthcare professionals, they came closer to the communities to provide those services to the communities that are poor. Some, they were charging them about 250, feeling and understanding where they are coming from, their background and their poverty that is interfering with them. But now they have destroyed the love that we have to treat them. They've destroyed that passion we had to treat them closer and at a very affordable prices. So yes, some of the colleagues, they've decided that they are no longer opening, but we still have those ones who are still willing to go back and say, we can rebuild. We can teach our colleagues, our communities, that what they've done, it has a great impact. It has destroyed us, but there's still tomorrow. So there are those colleagues who are still willing to go back and provide the same services. Hence, we are asking also those colleagues who are not affected to assist, to help those who are willing to go back. If there are still buildings that are intact, to be able to help them to rebuild on those buildings. And also the landlords to be powerful and fighting for any monies right now, to understand the situation and help the healthcare professionals to rebuild their practices.
Right. And how long does it take typically, Dr. Buthelezi, to get back on your feet after destruction of the extent we've seen in the week gone by? Typically speaking, any practice in a community that's been gutted, where medicine was stolen and the building may need to be re-erected, do you have a time frame of how long some kind of stability can return to that place?
Truly speaking, we don't, because some of the insurances, they indicated that if you claim it, will take about 3 to 6 months to pay. So to build, it will take how long to build? It can take a year or 2 years to rebuild them all, you know. So it might take time. We don't have a time frame right now. But all we are looking for is that maybe if there's a closer building that is there, is intact, can the landlords give it to the healthcare professionals so that they can start their businesses. But currently, to say when exactly are those who have their practices are being destroyed, they're going to start, we don't have any time frame for now.
Fair enough. Thanks very much indeed for sharing with us what you know nonetheless. Really do appreciate your time. Joining us there was Dr. Prudence Buthelezi. She's with the Healthcare Professional Association. Also adding some, I guess, complexity to our discussion is Rachel Perumal, who's a caregiver to her sister who's on dialysis and was impacted by the looting in the week gone by. To both our guests, once again, thanks very much indeed.